I'm Steve. Most of you know I'm in the health club business. I'm here with Dr. Nario of Biointegrative Health Center. Biointegrative Health Center is in Reno, Nevada. And we're kind of talking about some of the treatments they do in our series now. So you can check out Biointegrative online. So welcome, Doctor.
Hi, Steve. Thank you for having me again.
Okay, so I want to talk about Plaquex. This is a treatment that I'm getting regularly now. And, you know, I do liver cleanses, but Plaquex is a liver cleanse. So I want to kind of get into that and have you kind of explain it, you know, differences and so on. But let's start off with, what is it? What is this treatment? A Plaquex IV. What is it?
Well, Steve, yeah, you're right. This is something that we've been doing a lot of here in the clinic. And the best way to explain what is Plaquex is, first, I want everybody to visualize the toll gate when you get into San Francisco, let's say. And I want you to see it all open. And as that happens, you can see flow of cars and all the vehicles are pretty easy. So no traffic, right? But if some of them are closed, then you would see that there will be log jams because they're now all going to line up in one toll gate. People getting angry, they're sneaking through the lines, cussing and screaming, honking horns. So that's the reason why we want it all open. We want free entry, in and out, no chaos, a very easy system. And that's where Plaquex comes into play. I want you to imagine the image in your head to make it easy to understand, because the heart of the ingredient of Plaquex is actually phosphatidylcholine. And the thing here is, when we talk about phosphatidylcholine, these are the cell membranes, the cell walls of our cells, where toxins go in, toxins go out, electrolytes and nutrients go in and go out. So we have to have an intact pathway. And this wall contains all the proteins, the receptors, the channels. And at birth, we have this very intact cell membrane or barrier. Almost 90% of it are the phosphatidylcholine components. And we don't only have one layer of toll gate, we have two. So meaning it's a bilayer. So we really have a good checkpoint of everything that goes in and out of our cells. And this also acts as a liquid crystal semiconductor of letting in out substances and signals also, not only the toxins and nutrients, but also energy. And the name implies, as we call it, Plaquex, so it puts an X on plaques. So in the circulation to improve flow and better oxygen and blood supply into the brain, heart, lungs, and liver, and also other organs. And from the sound of it, it's also revitalizing organs, thus a good anti-aging therapy.
Wow, yeah, that's a good one. So can you maybe give us a little history of this? I know that you haven't been doing this treatment in your clinic for a super duper long time. I know you've been doing it for months, and I've been doing it for months, but what's the history of this treatment and how long have you been doing it?
Well, for the history of Plaquex really goes way back. I mean, it's even more than 20, 30 years. It's actually first being used, Steve, in Europe. And the doctor who started it all is Dr. Baxis. And Dr. Baxis actually, her family, she's a doctor, their families, family of doctors who actually started the research on Plaquex or phosphatidylcholine. And as it was now passed on to us anti-aging or integrated practitioners, we have now integrated it into our own anti-aging protocols. So for 30 years, our clinic has been running. And when I came in almost like 6 years ago, they already had Plaquex, but not named as Plaquex yet. So Plaquex has evolved to its formulary now. And it also started as what we call the liver cleanse or phosphatidylcholine. And later on, I'll expound on the difference of both. But basically, we have been using that component, but not naming it as Plaquex already. And again, the key here is experience and training, and various dosing also needs to be aware, needs to be knowledgeable by the one who administers it, and also needs to know the indications, the delicacy of the solution, and what can be mixed with, and understanding who are eligible and uneligible, and most important, the side effects that the patient needs to understand. So if infused, for example, if too fast can cause vein inflammation, it can drop the blood pressure, and rarely some hypersensitivity reactions. Knowing where the source is very important, where you got it from. The quality assurance is what you need to know, because you don't want to get it from any hole in the wall in the internet shop. But it all boils down to the experience and competent providers and staff that will give it to you.
Okay, so I've gotten a lot of liver cleanses, and I started with the lower dose with the Plaquex, but is the Plaquex, is that basically the same liver cleanse that I was getting before, just with something else added to it? Can you talk to me about the difference? Is the Plaquex the same liver cleanse with more, or is it something different that just cleanses the liver?
All right, good question, Steve. So now this is where we kind of draw the line on which is which. Plaquex actually is composed of the purest form of phosphatidylcholine, which is almost 90% phosphatidylcholine. The liver cleanse, or the plain phosphatidylcholine, has a lower purity of percent. And it varies in what pharmacy you chose to get it from. And it's specially made, which is Plaquex, and is being used in most, as I mentioned to you, in Europe, mostly by physicians there, to treat different indications, which I will discuss also later on. And more studies actually had been related to Plaquex in relation to cardiovascular benefits versus the plain liver cleanse. Cardiovascular benefits such as lowers the total serum total cholesterol, lowers the bad cholesterol, increases the good cholesterol, lowers triglycerides, increases glutathione levels, even lowers down the platelet stickiness, thus better blood flow, and also has less inflammation and less free radicals. And it also increases the membrane fluidity of immune cells, making them slippery or maybe a little sexier to go through the crevices and cracks to fight and go towards that infection faster.
Okay, so that answers my question. I appreciate it, because I've been meaning to ask you that specifically. So I think I got my answer, and it's basically, it's the same liver cleanse, but a more intense dosage. But you basically have the same ingredients, at least one of the same ingredients in both. Is that right?
Well, with the ingredients, Plaquex is actually, if you think about it, it's a trade name, meaning it's a patented name in relation to phosphatidylcholine. When you talk about Plaquex, there are other components to it.
Right.
Again, it's proprietary that is made by the company, but I know there are added vitamins in there that are not present in phosphatidylcholine to make it way more effective towards the cardiovascular benefits.
Right. Okay. That's exactly what I was thinking. Thanks for clarifying that.
Yeah.
So, what other, because I know you can't just go in and just do mix and match any types of treatments. So I sometimes will do the Plaquex with chelation, which is that really the only combination you recommend, or what other things can you combine with this, if anything?
Steve, the synergistic effects is almost seen in any IV that Plaquex is done with. Imagine, here's what I want people to imagine. Imagine open up all the gates going inside and out the cell. And now as you do that with Plaquex, IV vitamins and nutrients, which are actually deficient in cells, can now go in freely to regenerate the lack of supply that they have. Now, as they go in, that's the benefit, but as we open the gates, things can go out as well, such as toxins. So that's why detoxification is one of the things that Plaquex does really well with, also with our detox IVs, because it opens the gates to let out not only the bad things, but also the things that are not needed by the cell. And again, when you mentioned about chelation therapy, this is the bread and butter of Plaquex. It becomes its maximum when it's combined with actual chelation therapy that also helps with the cardiovascular system. For when you remove heavy metals out from the cell, and also again improves the circulation of the body, because heavy metals actually can clog up the arteries along with calcium, and chelation therapy removes that. It's almost like whipped cream, but it's organic and gluten-free, which you can use on almost anything, and it will still taste good.
Wow. So that's it just, you know how this stuff interests me. So what kind of, now I know we're not making any promises or anything or any guarantees, but I've talked to some people in the clinic that have gotten this treatment. I'm not going to name names, or I'll just say I said, wow, you know. So can you talk about maybe some positive results or testimonies that people have told you about, or is there anything that you can share without, you know, going over the line on doctor stuff?
Yeah, Steve. So I've really seen the power of Plaquex in relation to my cardiovascular patients, and that's why the good results are more of on this population. But I've seen total cholesterol, especially the bad cholesterol, go down, along with triglycerides. And even with people who, you know, I don't know if you've heard of the word angina. These are like on and off pains of because of the blood vessels in the heart kind of spasming. That also lowered down in terms of the discomfort that they experience. Circulation. I've seen black, blue hands and feet just turn around. Carotid blockages on your neck that was monitored by imaging that actually decreased and lessened. And again, the term of unclogging arteries can be, I guess, used and considered because of it being a natural draino or the clogger. And again, another one would be fatty liver. So it helps release most of that fat and get eliminated to get that liver running again. Brain function, as we all know, the brain is like made of fat, and phosphatidylcholine is a fat type of tissue, which actually gets attracted to fat matter. And stomach protection. I have patients who had heartburn, a bad heartburn, and sometimes they even get a bad ulcer from using ibuprofen or NSAIDs. Skin issues that like psoriasis that were flaring up so bad. Again, in general, as we call it, anti-aging, as I mentioned from your first question, that our skin always benefits from cell membranes that are getting rebuilt. And of course, pancreas and kidney functions that you see through blood testing results, and in general, very good antioxidant, anti-inflammatory, and also the immune system that gets improved. But in general, it heals all cell membranes that are damaged.
Okay, so I think this is my last question, but I always think of more, you know. But so let's say someone has a cholesterol panel, a blood panel that's off with their HDLs, their LDLs, triglycerides, and let's say it's off pretty bad. So do you have a standard protocol? I know everyone's different and it's probably not exactly the same, but do you have like a general protocol for someone who comes in and they need to, you know, improve their cholesterol or whatever it is, blood pressure? I mean, do you say, I want you to do 6 weeks of this, once a week, or what do you do? What's a general protocol for this, for someone with issues like that?
Well, see, again, the power of Plaquex, I've seen it, but I cannot overemphasize to my patient that lifestyle. stress management, dietary management still has to be there. But let's talk about Plaquex in general. The minimum amount of treatments for vascular diseases, again, this is according to studies in our experience, 20 treatments is a good standout protocol. Other indications other than cardiovascular can have less treatments in terms of requirements. Maintenance therapies, of course, in order to keep the patient's condition stabilized, it's recommended that they have infusions to 1 to 2 infusions every month. Again, another key to Plaquex maintenance is an oral form. That's why we have oral Plaquex also that goes along, especially for these maintenance patients that we have. And for our experience, and also as backed up by studies, for the study, this is really astounding to me. Even our little furry friends who got Plaquex benefited from it. The study was all about having a calcified aorta. That's your main blood vessel in the body. And after 2 months of Plaquex administration, this calcified whitish aorta turned back into this red vascular blood vessel again. But on our end, on a 6-week treatment, I've seen cholesterols go down. Even as I mentioned to you, the anginal pains attacks, like the frequency went down, and even the consumption of the nitroglycerine that these patients take to open up their blood vessels to increase the blood flow again. At 6 weeks, I've seen a good response to that. And for triglycerides, it's a little longer to treat. So IV therapy of 3 months. So again, dependent on how often the patient comes in. Another example is when people can't walk for a farther distance because of a cardiovascular condition. With a combination of IV and oral, I've seen 6 weeks improvement with those type of cases. Again, all examples, as I mentioned to you, are cardiovascular. And the good thing about that is all these same cases that I just mentioned are backed up by medical studies.
Wow, absolutely amazing treatment. So are you saying a couple times a month for maintenance for someone who's got a kind of serious condition, or?
See, for the ones who has like serious condition, for example, somebody who actually has a blockage in the coronaries or the heart vessels, once a week for at least 1 to 2 months, we want to suggest that. And then again, we'll observe and get blood testing after which. But again, that's a good standard intensive protocol for somebody who really needs aggressive therapy.
Wow. Okay, and what about someone who's just in there for general health? Once a quarter, is that good?
Yeah, so the maintenance, as I mentioned, can be considered like 1 to 2 infusions every month, so they can spread it out. It's probably better to do it at the beginning, at the end, or farther away from each other, just to get the blood levels almost like bridged up from the beginning to the end of the month.
Okay, well, that's an amazing treatment. It's called Plaquex. You can find out about it at Biointegrative Health Center. That's Dr. Nario. Biointegrative Health Center is in Reno, Nevada. So thanks for this information, Doctor.
Thank you, Steve. And as we all know, that knowledge is power. And thank you for letting me provide you with edge in longevity and health maintenance, which I call the biological edge or the bio edge.